Hello, this is a new episode for our podcast series of Synopsis, which is a meta-research unit at the University of Cyprus. And we have the great pleasure of having Georgios Nikolopoulos with us, who is an associate professor of epidemiology and public policy at the University of Cyprus. And our first question, as usual, would be, George, if you would like to tell us a few things about yourself, about your interest in science. In some sense, we would like to hear where you are coming from and where you're going in terms of your general interest and how you would identify yourself.
Okay. Zakaria, thank you very much for this kind invitation. It's a pleasure, really, to be here with you to discuss about my interest, but also our common interests in how we can conduct research better. As you said, I am an associate professor of epidemiology and public health here at the medical school of the University of Cyprus. My background, actually my first degree is in dentistry. Then I obtained a master's degree in biostatistics from the medical school of the University of Athens. And then I earned a PhD degree in the epidemiology of infectious diseases with an emphasis on chronic infectious diseases with high public health impact. These are HIV and hepatitis B. Actually, it was about the impact of co-infections on mortality of people with HIV. And I also got postdoctoral training in the United States, in New York, and my focus there was on the sociology and epidemiology of HIV spread among vulnerable groups, like people who inject drugs, in periods of social and economic turmoil, like the one we experienced in Greece between 2009 and 2015. So my main interest is in the epidemiology and the public health impact of infectious diseases, but also, and this experience started approximately 20 years ago, I am very much interested in systematic reviews and meta-analyses. So I have experience and I have also conducted research in all aspects of systematic reviews and meta-analysis, starting from developing new methods to developing software for meta-analysis commands and also using advanced methods, including network meta-analysis, umbrella reviews, and so on.
Brilliant. Thank you so much. So, drawing from your last point, I first need to express my pleasure when I discuss about issues with meta-research with people from biomedicine, because in some sense, you're my heroes for a good reason. How I view it is that what you're doing has very high stakes. I mean, you are dealing with people with HIV, so it's a matter of life and death. And as a lesson to the rest of us scientists, I feel that some of your practices echo how big the stakes are and how serious you take research, without saying that you are without flaws. But some of your research tradition has reflected this seriousness in, for instance, giving great emphasis in how we summarize from the totality of the evidence that we have, how we care about the quality of the overall evidence that we have, how we can safeguard the peer review process itself. So for me, being drawn into the area of what I call meta-research, the key contributions were from biomedicine. And a couple of decades ago, maybe approximately 15 years ago, there was a very active discussion, and that was when I was drawn into meta-research about the so-called credibility problem of science. There was a little bit of this, and it followed with a lot of new initiatives and changes. So how would you feel that you experienced such a discussion? Was it very active? Did it affect the way that people were attracted to thinking more about methodology, more about meta-analysis, or you feel that this was more of a discussion from the outside, but the biomedicine field kind of had a linear progress towards this interest in this kind of methodologies of meta-analysis, science for studying science? What would you say?
So you're talking about the biomedical field.
Yes, the biomedical field per se. Was there sort of a widespread discussion about a problem, or maybe not so?
I think these discussions about the soundness of methodology used in science and research affects every field of science, including, of course, the medical and generally the biomedical field. My experience is that starting from the early 2000s, as a young researcher then, is that before that, I mean in the 80s, in the 70s, the biomedical field was dominated by experts' opinion, which sometimes is sound, but on the other hand, it is not based on evidence from research. And I don't know if you are aware of this fact. The term meta-analysis and the methodology of meta-analysis started in the field of psychology. I think the name of the scientist was Jean Glass, who was an applied psychologist, an educational psychologist, who was disappointed by the fact that, mainstream therapies were based on experts' opinion and less on evidence. So he developed the method. He coined the term meta-analysis, an analysis that comes after primary research to support the field, the scientific field. So this tendency to explore the quality of scientific methods was transferred to the medical field in the 80s, in the 90s. Randomized clinical trials, which is perhaps the best research design used in medicine, was used extensively in the field to take decisions about the safety and effectiveness of medicines or other interventions. And at the same time, in the 90s, and especially in the early 2000s, there were discussions about how to meta-analyze research. And systematic reviews and meta-analysis are important not only because they provide us with an overall estimate of the effect of an intervention, of a medical intervention, but perhaps the most important thing is that it helps us understand why studies differ, what is the reason of their heterogeneity. So starting in early 2000, my experience as a scientist, I am not a clinician, I am not in the clinical field, but I am close to that. And of course, epidemiology and public health are around the medical field, is that there was genuine interest in using systematic reviews and meta-analysis to inform policy making, to understand why research does not perform well and how to improve research. So certainly there is discussion in the biomedical field about how to improve research methodology.
Thank you. And following up from this fact, the interest from domains such as the biomedical field and more recently social science, behavioral sciences in meta-analysis and appropriate summary of what we know. Obviously, society is interested in all that, in that we are able to make a correct assessment of our state of knowledge in order to basically change our lives, in order to apply it for policy. So the discussion that we are having so far regarding the methodologies that safeguard the soundness of what we are doing and getting appropriate understanding and summary of what we know are also crucial for the appropriate application of scientific insights for policy. And this is where we would be particularly interested to hear your involvement in this sort of policy advice in a crucial period during COVID, and especially to hear your view about the difficulties in translating scientific knowledge into policy, the difficulties in convincing policymakers about the relevance of studies, the difficulties into scaling up small-scale interventions as we do it in science into large-scale interventions in policy. So I'm hugely interested to hear insights from your experience.
Yes, certainly it was really a great experience for me. I mean, the last 3 years during the pandemic, because I was invited by the Ministry of Health here in Cyprus, along with other scientists in the field of medicine and infectious diseases and epidemiology, to advise on support measures, on containment measures and other policy interventions that were needed to stop or control the transmission of the new virus. Mm-hmm. It was a great experience for everyone, I think, because it is not very often that we face pandemics or public health emergencies of that scale. And although I was involved in the management of the previous pandemic, of the influenza pandemic of 2009, mm-hmm. or I was involved in outbreaks of infectious diseases like HIV in people who inject drugs in Athens, Greece, that was really unique. So at first, I think, the policy makers were seeking our advice, and I think this happened everywhere, mm-hmm. because the event was unique. We were not aware of the outcomes or how severe the outcomes could be. So we established a good relationship with the policy makers. The difficult thing was, of course, to explain in lay words mm-hmm. what the situation was, why it was important, and what the outcomes of the recommended measures would be. But I think over time we managed to achieve that, and to be honest, without any intention to flatter here the two ministers I collaborated with in Cyprus, we were, let's say, lucky because they were mm-hmm. people with open ears to hear. I mean, the two ministers, and they were also willing to hear and to use our advice to inform their policy. Something that we should make clear here is that science should not replace the democratic policy-making system, because there were voices who said, the politicians should follow exactly what the scientists say. That is wrong, because we live in democratic systems, and people are elected to represent us and to take decisions taking into consideration all the aspects of economic, social life, and so on. So I think the important thing for scientists is to give their advice, to give their advice based on sound evidence, or at least to the best evidence that is available at the moment, and the policymakers should consider it, but also taking into consideration all the other aspects that scientists are not necessarily trained to provide advice about it. So in general, my experience here in Cyprus was good, I would say. That early we established a good relationship, that policymakers were willing to hear, and we tried, as members of the scientific committee, to provide the best evidence available. Of course, there were flaws. Of course, there was lack of evidence for some of these decisions, or the best evidence, and there are thoughts how to improve the process in the future. But in general, in Cyprus, I think the collaboration was nice, with weaknesses and problems, but I think the experience was good.
Oh, thank you so much. And following up on your on your view about the ultimate decision maker being the politician as a representative of the people, let me just echo this statement by saying that social scientists usually view things explicitly from two different perspectives, the positive and the normative. And in some sense, the positive is where science goes in exploring the relationship between phenomena. If you do this, this is going to be the most likely outcome. So this is, roughly speaking, the role of the scientist. But ultimately, exploring these mechanisms into a final outcome, in other words, in the end, what do we want to achieve after understanding of these laws of nature? That's a question that is normative, that should come from the people with democratic processes, and maybe scientists, or if you wish, philosophers have a role there into helping people and educate them to make appropriate choices, but not obviously to answer the questions on your behalf. But again, following up from something that you that you just said about what scientists should be doing, this coronavirus era was pretty challenging in that it seemed that scientists should be very careful in how they express their views. Many scientists were heavily criticized as misleading the public, other scientists as not being responsible. I understand this is a very difficult question, and I'm interested in it in the sense of maybe generating some discussion and some thoughts for how we should think about this problem. You just said very interestingly that we are not trained necessarily as scientists to communicate to the public. So I would say that each one of us, when faced in a situation like yours, would just have to have a personal philosophy about how to communicate. What was your approach, and in general, what do you think about this issue of responsible communication in science?
Okay, very good point, Zacharia. This is something actually that I've been thinking over these years, and I continue to think what is the best approach. First of all, in terms of scientists, I think they should be free to express their scientific opinion. Now, there is one issue here. When a scientist belongs to a certain scientific committee that has been appointed to advise the policy-making system in a particular setting. Now things become a little bit complicated because scientists do not always happen to fully agree. So the decisions are not always unanimous, and this is, let's say, healthy to get different views and then to decide on which is the best approach to a certain problem. However, when you are a member of a scientific committee, there is, let's say, an issue about how to communicate the decisions of the committee or your personal opinions, which might be a bit different, to the public, because it is very important to make sure that as scientists, and especially as scientists belonging to a scientific committee, do not confuse the public. So for me, I think the best thing would be, if you are a member of a scientific committee, to express your scientific opinion during the meeting, and the minutes of the meeting should be transparent and public, where people could follow the recommendations and how the final decision was made. Then the communication of the final decision should be either from the policy making system or from one representative of this committee. If, as a scientist, you are a member of a committee and you find that the discussions during the meetings or the final decisions are far from your point of views or your ethical code, then you have any right to resign and to express your disagreement openly to the public. So I think for scientists, the basic principle is, yes, we are free to express our scientific opinion, which should be evidence-based or based on our long-term experience and expertise. However, when we are members of a committee and there are certain obligations with the policy-making system, we have to take into account these issues, the problems, the communication problems that may arise if we agree on a decision, but then publicly we do not support this decision.
Getting back into something very important, you said the concept of confusing the public. It's very important and challenging to think about how the average person in our democracies views science. Does the public really understand science for what it is, or does it elevate it to a status of some kind of greater infallible authority that it truly is, maybe because of a deep need to do so as a human society. So oftentimes I am a little bit saddened during the COVID when scientists were criticized for allegedly being inconsistent, is that before you were telling us we should be using masks, now you're telling us that you shouldn't. So it seems maybe there's a little bit of a distorted or immature view that might be my impression, and it's worth discussing about what scientist is and science is, and what scientific findings mean, and also about uncertainty in science, how we should be conveying uncertainty in our estimates. That's another big issue, especially for social scientists and macroeconomic models. But let's not get into that. What is your view about these concerns? Whether the public is realistic about what science can do?
Big issue, and I feel that the increasing trends in of mistrust, let's say, among the public is probably, although I have not done any serious research on that, or I am not an expert in communication, but I think what we saw, I mean, this mistrust among the public was the result of communication failure and a problem about understanding of science among the lay public. So the problem concerning the latter is deeper and has to do with the training, the basic training we receive during school about science and scientific methods. What is science? I mean, there is something we do not know. We formulate a hypothesis, and then we design our efforts to give an answer to confirm or reject this hypothesis, and then we reach a conclusion which stands for the moment. Because if new evidence comes in the future, then we can reject our previously accepted hypothesis. So this is very important to make sure that during school years all people are trained to understand the basics about scientific method. And then in terms of public health and this kind of events, it is very important to communicate science in the right way. Perhaps the first error that we committed as scientists was that we were not clear that this is a changing situation. So something that we suggest now perhaps will not be valid in the future. So to convey the message of uncertainty from the first time, which is very important. And the second was that especially myself and others, because I feel that I have committed the same error, we had to be very, very careful in terms of our public appearances. It happened to be the case when, every single day, there were multiple appearances on the media. So this increases the likelihood of saying something wrong or saying something that contradicts something you said the previous day and so on. So that's why it is very important to have a communication strategy that covers the way scientists who officially, formally belong to advisory scientific committees to follow certain rules about communication. So in order to conclude, I think we have to improve both the communication strategy at the public health level and also to improve training of all people on scientific methodology and the uncertainty in science.
That's a great point, and it's definitely shared. Maybe, as we said before, combined to some sort of better understanding from the perspective of scientists, and maybe more systematic about how we should be communicating. So, approaching towards the end of today's discussion, And since our meta-research unit synopsis is interdisciplinary, and meta-research is an interdisciplinary field, roughly speaking, it is a field that studies how to improve science and to make it more useful for society. And obviously, this is a question shared by every scientific field, and that's what brings together researchers from different areas. How would you reflect from your personal experience about the importance of interdisciplinary research and the capacity of scientists from different areas to communicate and find a common language?
Yes, this is very important. I mean, in our days, interdisciplinarity in science is a must. And it is very important to make sure that scientists from different fields understand each other and come together to bring their own unique experiences and knowledge from their fields in order to start something, I think, innovative that would cover many areas. And this became evident during the COVID pandemic, because as an epidemiologist, I thought that, okay, I am the one who knows about transmission of diseases, about spread and so on. But then I realized that perhaps physicists or engineers understand better how, for example, a viral pathogen could be transmitted in the air. So I soon realized that perhaps these are the experts, and our collaboration will increase our understanding of COVID-19 transmission. And I had other experience from my own field, the field of HIV. One of the innovative prevention approaches in HIV was one that was based on using social networks to diffuse information about HIV transmission. And this was something that was brought in the HIV field from sociologists. So good sociologists share their experiences with HIV epidemiologists and clinicians in the mid-80s and 90s and performed some wonderful social network-based studies in the field. So for sure, interdisciplinarity is very important, and I think is a basic step forward to advancing the quality of research, because also about positive criticism of our work. If someone who is not deeply involved in a field,
without stake.
Yes, without stake, without prejudice, without bias, perhaps that person would be a good advisor who would help us improve our work. So interdisciplinarity is a must. I fully agree.
Excellent point. So, looking a little bit back in your career, in your achievements in scientifically, and also helping with important policy problems, would you say that you have maybe one regret and one particular joy that you would like to share with us, potentially?
Yes. Perhaps there are many moments that I felt let's say, happy, or other times that I had, let's say, bad feelings. In general, I feel that over the last 3 years, that was a nice moment of my life, because I felt that I somehow used the experience and knowledge accumulated over the years to support the decision-making system of this country. I'm not from Cyprus, I am from Greece, but of course I feel, I have emotions and I feel the connections between the two peoples. I mean, we have many in common, so that was really nice for me, that I used this experience and knowledge to support the decision-making system in another country that is very close to me. And of course, I live here. Perhaps, as I said, the regrets are about things that could have been better here during these years. I told you, for example, that I regretted my very frequent appearances on the media, because sometimes this might contribute to the increased confusion. So if I was to come back, perhaps I would strongly advocate for better communication strategy. So perhaps these are two things that come now in my mind. Perhaps there are more, but I think since we discussed about this period, I think that these two come now in my mind in terms of what made me happier and what made me sad.
So, George, thank you so much for your presence with us. I'm particularly happy again for being able to speak with a person from the biomedical community, getting different viewpoints on issues that we have been looking from the social science perspective, and hopefully the insights that we get from this podcast will give us food for thought for maybe exploring those in using the scientific method itself. Once more, thank you so much.
Thank you very much for the invitation, Zacharia, and congratulations for the nice work you have been doing with your colleagues here at the university, and it's always a pleasure talking with you. Thank you very much.